This is going to be an easy plank position to do at a counter or a table. I spend a lot of time with patients trying to get them to have awareness of their stomach. So I start off in a position where I'm leaning on the counter, and I try and make sure people have the understanding of, as I press my fists down into the counter and I keep my shoulders away from my ear, I have two options at my pelvis. I can let it tip forward, or I can tuck it underneath me. So as I press down into this counter, I want to try and do more of the tucking my butt underneath me, not super hard as I can, but just a very slight pull where I feel like I'm pulling my belt buckle a little bit up and in, and I'm tensing my lower abdomen. So it doesn't have to be aggressive, but it's just a press down into my fists and very lightly pull my butt underneath me without bending my knees and without excessively rounding my back. And once I've established that, I press down, right? And I want to see here, and I'll show you from behind, right? If I can create that pressure and keep that. Now I'm going to start to put my weights more on one leg, and I'm going to keep that same tension as I bring this knee up towards my chest, and as I take this leg slowly behind me. And you'll notice I'm just straightening the leg. I'm not trying to lift it real high to where now my back arches again. So before I do the exercise, I do that little drill of, okay, I don't want this. I want to lightly tuck my butt underneath me. Okay, I press down into my fists, and I try and maintain this lower back position as I shift my weight to one leg and very slowly lift one knee up towards my chest and very slowly straighten the leg behind me. And I'm really trying to go through this motion without anything changing in my lower back. So once again from the side, and I can be a little bit more resting on the counter so I have a little more support. It's the same, not this, maintain that as I start to slowly lift, and I'm pressing actively down into my hands to make sure I keep the muscles in my stomach engaged. As far as my head position, because I'm leaning a little bit forward, I don't want to be like this. I want to keep my chin somewhat close to my throat so my gaze follows the position of my upper torso. I'm trying to pull my shoulders away from my ears and actively press down into the counter.